to have the Superior Court validate the agreement with tenant. I understand that the purpose of the validation is to eliminate uncertainty and confirm the legality of actions, such as a public agency's issuance of bonds or validating contracts entered into by a public agency. What is difficult to understand is why Eisenhower would challenge the outcome of Measure AA because they lost. They voiced their opposition of the ballot measure during the campaign, but the voters made their choice. Eisenhower's frivolous, expensive legal action is a desperate attempt to sabotage the will of the people. It's a slap in the face to the voters and democracy. It's anti-democratic. The money they are wasting should be redirected to care for the underserved in our community, the ones who really need it. Steve Sanchez.
Thank you. Any other comments online?
No.
In person?
Does it indicate if he CC'd Eisenhower on that?
He just sent the email to myself. Yeah. I don't know. He may have blind copied them.
Thank you, Andrea. All right, so before we get started with our item E, we'll go ahead and do intros. Welcome, everyone. Kimberly Barbosa, Director with the Desert Healthcare District, now on for almost 3 years. This is what our third legislative committee meeting. It's a brand new committee, and so I welcome you. Thank you for accepting the invitation to come and provide an update. I'll go ahead and get started. Let's do this to my left, and then that way you'll be able to get our staff names and then.
Good morning, I'm Greg Rodriguez, and many of you. I was elected to the board in November of this year. I currently work for the County of Riverside. Done the political thing. I worked for Supervisor Perez for about 5 years, and then was Congressman Ruiz's district director. So I know the jobs well. So welcome, glad to have you.
Hi, I'm Donna Craig. I'm the Chief Program Officer, the Desert Healthcare District, the district going on 21 years in June.
And I'm Andrea Hales. I think I spoke to you all. I'm the Special Assistant to the CEO and the Board Relations Officer here with the district.
My name is Eric Taylor. I am the Chief Administration Officer here at the District and Foundation.
I'm Chris Christensen, the CEO of the Desert Healthcare District and Foundation.
And I'm Alejandro Espinosa, and I'm the Chief of Community Engagement for the Desert Healthcare District and Foundation.
I'm Will Dean, Director of Communications and Marketing. If you're okay with it, I'll be snapping some photos for social media.
Hi, everybody. My name is Felipe Ortiz. I work for Assembly Member Greg Wallace. I think I've worked for him since 2023. When he first got elected. Happy to be here.
Armando Avalos, with State Senator Steve Padilla, and happy to be here.
Jocelyn Ramirez, with State Senator Steve Padilla as well. We have the district, district representative, and we cover the Coachella Valley office. Good morning, my name is Ashley Hannes, Chief of Staff for Assemblyman Jackson Song.
Hi, everyone. My name is Nick Anziano, District Director for Assemblymember Greg Wallace as of February. New to the station.
Hi, we're doing intros, name and organization office.
Perfect. My name is Daisy Bastida. I'm with Congressman Raul Reese, and I'm his Deputy District Director.
Hi, everyone. Frank Reese. I'm his District Director.
Alrighty, welcome. Thank you for joining us. I was just letting them know that this is our third legislative meeting, so it's a brand new committee. And thank you for joining us and for excited to hear from you guys. So I'm just gonna go in order of our agenda if you guys don't mind. It'll be fairly quick. We did run or sponsor a bill. You have Carol. She's a member of the committee, but participating as a member of the public.
Did you want to say hi, Carol? Hi, Carol. We can't hear you. You have to unmute.
There we go. Yes. Hello, everybody. I'm listening in from remotely.
Thank you. Senator Ochoa has a bill that would be asking the state for a feasibility study on freestanding emergency department. And so the bill during Health Committee was made into a 2-year bill. So we continue working on it. We do have an update. Will it be from you, Chris, or from?
Yeah, Tish Rylander is with us. Tish, if you would please give us an update. Tish is our lobbyist with our lobbyist firm and works very strongly there in Sacramento with our legislators and the legislative process. So Tish, if you would, please.
Thanks, Chris. Yeah, I'm not sure if everyone got an opportunity to watch the hearing either live or after the fact, but it was Obviously, for those in the room, Senator Padilla is a member of the committee, and um, uh, we had talked to his office extensively about the bill, but it was in a very unusual hearing. I haven't seen a lot of hearings happen that way where it was clear that the chair of the committee was a no recommendation. And then by the end of the hearing, had decided to, uh, actually reject the motion for the vote and came to an agreement with the author to make it a 2-year bill and to continue conversations. And I think it was very clear through the hearing that members on the committee would vote with the chair if she was a no, but had real concerns about access and healthcare access, and really, I think, wanted to see some sort of study done. And at the minimum, wanted to carry on a conversation after several strong statements by members. But we had great witnesses, and Dr. Kumar was able to stand up and provide a Me Too on behalf of the district. And so in the room, it was, I don't know if it translated onto video, but it was a very intense hearing. And Senator Ochoa Bug was very committed to the issue and has since expressed to us directly that she is still very committed. And so, it's a 2-year process. I think obviously we have to continue the conversation with the chair. And the author will also need to follow up with the chair and with staff. But, I think following up with the members of the committee and, working with them to address some of the concerns. And I think looking at other mechanisms for having the issue out there. I think looking at perhaps a JLAC, a Joint Legislative Audit Committee request might be something that we could pursue. But definitely continuing the conversation so that as of January, when the 2-year bills have a deadline, there's like a 30-day deadline once they come back into session to review the 2-year bills and decide whether or not they'll be moving. So, this is a time where we would sit down, talk about, are there amendments that are more palatable for the chair? Is there a version of this bill? I mean, we had pretty much made it as non-threatening as possible, given the lightning rod that is FEDs. But is there a middle ground that we can get to with the chair so that come January, we can move the bill? And that's going to take a lot of conversations starting now through the fall and into the end of the year so that we can best position the bill, work the committee members, and even deploy some of the committee members to have a talk with the chair and see if we can provide her information that would help change her stance on FEDs. And it sounds like even a member of the opposition, not labor, but the Emergency Physicians Association, I think they are open to pushing forward. I think there's an opportunity to have some of their internal members weigh in and get the association to take a different position. So there are a lot of different conversations that need to be had, and this is the opportunity that comes with the bill not just outright failing, but being made into a 2-year bill so that we can definitely move forward in the conversation and find some sort of middle ground. And, I think it'd be even worthwhile to meet with labor, but, I think they're going to be pretty unmovable in their position on this.
Thank you, Tish, for your update.
Yeah, of course.
Chris and I'm not sure if you'll be attending, but we'll be up in Sacramento next week. And if we have an opportunity to meet with the senator, let's make it happen, or a member of her team. I did run into her at an event and we were talking about the bill. And one of the things that I mentioned to her was maybe the possibility of inviting committee members to tour or come visit the district. Some of the comments just seemed that the setting of what we're talking here, it didn't seem to connect with one of the committee members. And so I'm not gonna say that we wanna expose them to the situation, but bring him down and, you know, maybe a tour of like Eastern Coachella Valley and in other parts of the district that would very much benefit from a freestanding emergency room.
Yeah, I think that would be incredible. And maybe we can even, like I know Shannon Grove was very passionate about her district. And so for these urban members who, don't spend a lot of time in rural areas, maybe there's an opportunity there to look at a district hospital in, northern, like Central Valley area and do a twofer where they can see some of the challenges there and they can see the challenges in our district as well and get a whole comprehensive snapshot of, why it requires a different approach than what they're used to seeing in the Los Angeles area.
Thank you. Yeah, let's go ahead and do that pitch and hopefully, we can have them come over. Greg, any comments?
No,
Questions?
if you do get a meeting, let me know. I will be in Sacramento, but I'm at a
Okay,
different.
Okay,
thing, but
alright,
I thought I
okay.
could be close and pop by.
Okay.
I think there's opportunity for the other offices. We've talked about this specifically Senator Padilla, but also the 2 assembly members as well. So we do a companion bill in the assembly. And so we're, happy to educate you and the members more on that. But I think if we went in with a bigger coalition, that might help a little bit more.
Stop, Chris, anything that you'd like to add? Any questions?
Did anybody ever capture the concerns, like list all the different concerns so they could be addressed individually or look at them, as, holistically type of thing? Because Tisha mentioned there's a lot of concerns, but what were those? I mean, if you weren't listening to the hearing.
Yeah, I'm happy to. Oh, sorry, go ahead.
If you want to give us that.
Yeah, I think for the chair, I mean, there were the concerns expressed by labor, which I think that most of the committee members felt was really just an opposition on principle because they have a general opposition to FEDs and didn't even want to study. I think for the chair, her concern was that the majority of people will utilize FEDs as urgent cares and that as urgent care clinics but the rate and the payment would be so much higher. They're concerned that, that the FEDs will pick off higher paying patients from hospitals. And that really for labor, their concern was if the system's broken, let's fix the system. Let's not just put a patchwork solution together by, erecting FEDs. But in reality, this is a study. And we tried to really press that point of instead of hypotheticals and guesses, let's actually dig down and do a study and evaluate it and then base policy on an informed, data informed way. But I think that the one thing that the chair just kept coming back to was, folks are going to use the FEDs like urgent care centers, and they are going to, but it'll be a much higher cost, 3 times the amount than if they just went to an urgent care center. And so I think we've got to figure out a way to present her with the information and the facts so that we kind of dilute that talking point.
Well, and I think the Dr. Casanova, addressed that question, I thought quite well, because he did point out that Dr. Casanova is the director of the ER at JFK Hospital. And so he had indicated that, that happens in even the attached emergency rooms at hospitals where people will use those as urgent care services, and they don't realize that there's then a different cost associated for insurance purposes at an ER rate versus an urgent care rate, which is much lower for urgent care. So I think there's an education component there that has to happen with the community, that it's if you're going to the ER, the remote ER, it's an ER, it's not for urgent care purposes. But and I think some of that has to come from kind of the triage component of it too, that would be able to determine as a person comes in, whether this is a true emergency room situation, or if they can direct them to more of the urgent care environment, so.
And I think the emergency physician's representative that was there, he had a really good conversation with Dr. Kaznam about what other states have done with FEDs and the billing and how they were able to bill appropriately and, specifically for, the if if it fell under an urgent care type service, then that's the rate that it would be billed at versus an emergency care service. So, California is much more complicated, and I don't know that we want to move in that direction. But just talking about what other states have done, and a willingness to be very thoughtful in our next phase of this, I think was enough for the emergency physician representative to say that they're willing to consider changing their position and being at the table as we look at next steps.
Thank you. Anybody here in the room? Any questions you might have?
Does that have any co-authors attached to it?
No, we don't have any topics at the moment. I don't think any, no, they would have been at it during the meeting.
We certainly welcome them, though.
I watched that committee. It was pretty rough to watch. But okay, I'll speak to the on.
It was, for those that did watch it, it was an interesting conversation. Absolutely. Again, I feel that coming from the chair, not being familiarized with the area. Other states do allow these. Some say that they don't work. Some others say that they're working magic. We just want to find out if it's possible, what it would look like, implications, cost. And so that's what the study would be. The study is not asking for the creation of a license. It's just an initial study. So we're hoping, I know that Chris, you met with Senator Gonzalez, Assembly Member Gonzalez, and he did
Yeah,
express
and
that.
I think from the assembly side, you guys were going to co-sponsor or whatever if it comes through the assembly.
Yes.
And that, so yeah, so there's support there, and bipartisan support, is huge in this process as well, so. Hate to bring politics.
Forgive my lack of education, but what exactly is the definition of an FED? Is that the acronym FED? It is. Like, is it a certain distance away from existing medical facilities?
That's a great question.
It is, and we do have it there, and it just closed the tab with
Let me
the
pull it
bill
up.
on it.
Yeah, the definition is in the bill language. It was amended to include a definition. So I can try to pull that up, but I'm remote on my phone, so you'll have to forgive me because I'm in the swing space right now.
It's
Freestanding emergency department.
But he's
you're.
asking-
Yeah, like, what does it mean
Oh, yeah.
exactly?
right. For
Rural.
rural, disadvantaged, and underserved areas with limited access to
Okay,
emergency care.
We have it up, Tish.
Awesome. That's what I expected.
And so we just want to find out if, are they gonna work,
Here it
do
is,
they have to be
lines,
within the
right
same. Well, these would be under the same, connected to another healthcare, system
Okay.
provider. They wouldn't just be on their own, which is one of the, concerns that were, shared. So they wouldn't be just on their own, they would have to be under, a healthcare system. And I'm also thinking, for this bill, for areas like Imperial County, with them merging hospitals, having people, that live 30 miles away from, the Central Hospital, the Brownie Hospital. And so we're looking at this. We're very happy, we're glad and grateful that Senator Trouble will continue with the bill because she had the option to just, let it die. So we're grateful that we're continuing the conversations and we'll continue working on it and hoping that you're going to get this, not that this would be an official request if you guys hadn't gotten it. But I'm looking forward to, continuing the conversation, especially as you might all know, being a member or employee of the state legislature, working here on the ground. I know the importance of being able to advocate for our own districts at the state capitol. And knowing, right, being the ice and ears and being here on the ground, knowing what's going on and being able to communicate that to other legislators that are not from the area or familiarized with what an area like ours look like. Any other questions? Any public comment?
Well, Helen, I think too, part of the purpose of the FEP in the rural areas is to be able to allow a patient or somebody that's in a trauma type situation where they have a shorter distance to go than the nearest hospital that may be, 30 minutes or longer away. So they're able to get to a location, be able to be treated, stabilized, and if it's more trauma than that ED is equipped for, then they're able to stabilize and transfer to a hospital, say to Desert Regional or any other hospital where they would get that more specialized care. So it's providing that service that might be, that is missing in some of those rural areas, especially as population expansion pushes out further into those areas as well. So
Let's go ahead and move to the next item. F1, AB 259, open meetings, local agency teleconferences, update. Would that be coming from you, Priscilla?
So Tish, do you have any update with that, or I'm happy to do if you don't, but I think this is just a general one that is looking to extend the date. There's a sunset date on this particular bill that allows public meeting access remotely by directors. And there's current sunset of January 2026. So the bill doesn't change the actual language, to my understanding, other than to extend the date. And so what this allows is for directors to be able to sign in remotely to a public meeting. There's two ways of doing it. One is to ensure that they have their name and location on the agenda of where they're going to be for that meeting. So in theory, it can be published. The agenda can be published publicly in those areas and allow that director to participate remotely. But it still requires a quorum of either the committee or the board physically present in the location to hold a meeting.
And so these are just some bills that we're tracking, or this is one of them. You will hear from it. It's not specific to healthcare districts. It pertains to any local
All
public
special
meetings,
districts.
special districts. So you might hear from others as well on this one.
And the only change is just the date to January, to
Mhm.
30.
To 2030.
2030.
2030. Yeah.
It seems so far away, but it's not. It really is. Any other comments?
Local agencies. No, but it did pass the Assembly before, so it's on to the Senate now.
Okay. Thank you for that.
And then these are some of the supporters of the bill.
Yeah, you can see a whole bunch of, yeah.
Healthcare
Special
districts,
districts.
yeah.
And we did submit a letter for that, right? Is that the one?
We did. I
We did.
know it's on here too.
Alrighty. F2, AB 2019 healthcare districts.
Okay, this is a bill that was passed, I believe in 2018, 2019, I forget. But it's related to how healthcare districts can promote our grant funding process. So we're not allowed to, as either directors or staff, to go out to the public and essentially solicit grant recipients to say, hey, we want you to apply for this specific item for, 200,000. It creates some favoritism, and so the purpose of the bill was to limit that kind of communication prior to an actual grant being requested. So once a grant is applied for, then we as staff and directors can meet with a grantee once they've applied. However, prior to that, it's very limited. So our purpose in revisiting this is to see if there's a way to allow more communication with the public to engage and, provide the opportunity for more grantees to apply for grant funding. So it's more of a public awareness type situation that we're looking at to see if there's more flexibility around. So it's kind of in early processes, but Tish and her team are working on that to see if there's some opportunity there, actually speaking with the author of the bill. I forget the author's name, to be honest, so.
It was Cecilia Aguiar Curry, and it was a 2018 bill.
Thank you.
And so mainly what it is, right, it came about where you would have areas or organizations, districts going, like Chris mentioned, to their friends and be like, hey, we have some money coming down the pipeline, make sure that you apply, make sure that you do this, do that. So to eliminate that and out of by transparency, that's where this bill came from. But we wanna, we're looking at it to see if there's any amendments, because it makes it a little bit difficult on how we communicate that to the public. And so that we're not, breaking the law here, we wanna see if, what are the amendments that, can be incorporated, and of course, or with the author, and see if that's something that she would like to run herself, or because she's the original author on it. If not, maybe in the future, we'll hit up, one of our local legislators and see if that's something that they can help us with. And we'll have more information, of course, when that time comes. Any public comments?
I would just add that it's challenging in areas like this where a lot of us know everybody. And so when you're curtailing the type of communication that you're gonna have, especially with those of the people that we know that run organizations that would be perfect fits for some of the grant making that we do. So it just is difficult in this region. That sounded a little conceited. I didn't mean to.
Or those entities typically made aware of it.
But all they have to do is apply. And we can
Apply and
open
we
that
can open
conversation
things
immediately,
anyway,
so,
yeah.
you know.
Essentially, right now, it's just, we do different kinds of media outreach, but it's kind of broad. I mean, we'll, announce that our budget or our strategic plan and what our strategic goals are that we're funding. So we'll do e-blast, press releases, we'll do some advertising in newspapers. Anytime that we're awarding grants each month, we will do an announcement, that goes out with, hey, these grantees received X dollars for X purpose. And any way that we can do kind of a general communication to the public without inviting or soliciting. Soliciting is probably the better word than inviting, but just to have that balance there that we can engage without soliciting, I guess, is the way to describe it.
It really pertains within our grant program, because we do have other ways that we communicate, or that we do ask for, like our RFP process. That's different, but understanding that this just pertains to the grant. So
Yes.
let's say that I see someone, Greg mentioned you're at an event and someone comes up to me or one of the directors and we start talking like, hey, I really want to apply for a grant, and like we just can't engage in that conversation. That would be.
All we can say is, apply to our grant funding application process online. And once the application occurs, then we can engage more with them and helping them, format or formulate their grant request so that it can be acceptable for receiving those funds.
I don't know, Tish, did you want to add anything to that at all, concerning the bill and?
Yeah, I mean, I think that this is a pretty controversial measure. It was in response to specific cases, from what I understand. The author will be hesitant to reopen this conversation, as I'm sure other entities might be as well. But so I think it's critical that it's not just us asking for it, and that there's a coalition we build to help go in, especially that, not small nonprofits that need more assistance or that need more outreach, and having them uh, reiterate that need to the assembly member, because we certainly need to go back to the original author to talk about it. And while she may not be interested, it would be helpful to have her blessing to pursue another author, because she is in leadership and has feels very passionately about the issue. So I think, there's we just really want to be thoughtful about when the time is right and who goes in initially. And so that we're putting that all together and making those considerations now ahead of, when the prospective bill introduction timeframe would be. So we want to lay that groundwork in advance.
Tish, what is ACHD of all the other healthcare districts that do give out grants? Have you heard from anybody else that they have the same concerns that we have with this bill?
I think it's a diverse perspective on an association level. But obviously we've not had those conversations because we certainly want to keep this close to the vest until we have a broader coalition. But, ACHD will be important in having the conversation, and it depends on our approach too. So I think they may have a diverse position with their different members, but I think there's a way that we could get them all there depending on which direction we go in.
No, I didn't mean what ACHD stances were. If any other healthcare districts, separate healthcare districts have announced or mentioned that they have this same, that's not a problem, but concern, challenge.
Not that I've been made aware of. I think conversations have been very limited, but it doesn't sound like from my conversation with Sarah that anyone has raised this issue yet. But I don't. It may be that if they raise it, that folks will offer up similar challenges. But as of right now, proactively, they haven't.
Thank you, Tish, and that's something that the committee will be working on or start developing a little bit more ideas or jotting down some notes on a direction on this bill, or if it's something that we will pursue, but I think it's very much worth our while. Okay. Alrighty, so any other questions, anybody online? Andrea, that has questions?
No public comment.
Okay. Alrighty, so our next item is local legislative updates and current trends. We'll go ahead and get started with my right. If you have anything to share, any updates on what your office is working on, either here locally or up in Sacramento. If you're interested to hear, some of the bills that you guys might be running, up in Sacramento, or, sorry, we began the conversation with
Yeah, that's what I mean. Yeah. It's our local. Then we can,
And then also, we want to check if there's any way or any areas where the district should or should be, in of support to your office. I understand the value of that because of my background and having those good relationships with our local nonprofits, our special districts, cities, community in general. So please, I'm not sure that we are for like 3 minutes or so.
However,
we don't
no,
want to, because we
I
don't
just-
want to be here for like the whole day either. I don't see any lunch stock in it, so we want to, what time is it?
20 bills.
Well,
But please introduce yourself.
yeah, absolutely. Again, thank you all for the invitation. My name is Nick Anziano. I'm the district director for Assembly Member Greg Wallace. And I am, kind of new to the scene. And so my understanding of my role here is more of just kind of to learn what you guys need and how to strengthen the relationship, like you mentioned. I did come with a few notes. I've got one bill that Assemblyman Wallace is the author of that is somewhat healthcare adjacent. But first of all, Assemblyman Wallace is aware of inequities in the healthcare system and understands the importance of supporting his constituents to the fullest, and working with entities like yourselves in order to do so. You wanted to echo that operating a hospital is difficult under the best circumstances. Understands there's a lot of uncertainty with where dollars are going to go, and just to thank you for being such an influential member of the community. The one bill that we have that Assemblyman Wallace has on the docket right now is AB 1293, which is, again, it's healthcare adjacent. It's a workers' comp bill. It's meant to sort of streamline the qualified medical evaluator process. So from the fact sheet, the wording is it modernizes and streamlines the QME process to ensure injured workers receive timely, high-quality medical evaluations. That's in the works currently. And Got a couple other, you guys are probably aware of all the legislation going on actively currently, but if there are, after we have our discussion, anything else you want me to bring up, I certainly can.
For you to be the first one, and then if you guys have those in vote, just.
So if you want to come back to me with any, I do have a few different notes here.
All right, thank you.
I will try to stay to 3 minutes. I can't make any comment. Good morning. My name is Ashley Annes. I'm the Chief of Staff for Jeff Gonzalez. Just a little bit about me. I promise this will be the longest update I give, and then I'll keep it short moving forward every time we meet. So just a little bit about myself, just because most don't know me. So I'm a native to Indio, born and raised in the Coachella Valley, went to Split COD. I worked for Senator Melissa Melendez. I did my time in Sacramento for several years, working for the state party as the Deputy Communications Director and Caucus Liaison. So was over Sacramento, decided to come back because there's no place like Jeff. And Jeff is a great member. If you have not met his uncle, Jeff Gonzalez, he's truly just a wonderful person. He understands the struggles of the healthcare system and challenges that we can face. His son does have cerebral palsy. So he understands the importance of quality healthcare. I know that we met with Chris about a month ago, spoke about being a co-author for SB 588 for Senator Sheila Vogue's bill. So I'll echo what the Assemblyman always says, which is we want to be good partners. So whatever we can do for you, whatever you need, just let us know. Unfortunately, I'm not a mind reader as much as I would like to be. So I don't know about every single bill. I don't know everything that's going to possibly come across our desk. So just give us a heads up before it becomes an issue. So if there's a possibility that we can all work together to, fix that, we'd love to do that. So let's get into the update for everyone because this is a little long. So this legislative session, the Assemblyman introduced AB 676. This bill authorizes the Department of Healthcare Services to waive the interest that would otherwise accrue when DHCS seeks to recover an overpayment made to medical service providers. That bill is an appropriations. That's going to be for tomorrow. Adjacent, AB 641, drug-induced movement disorders for neurological conditions caused by antipsychotic medications. We want to make sure that there is awareness to diseases like tardive dyskinesia. So we've co-authored a handful of bills. I will try to run through these. AB 81, authored by Assemblyman Shrita in regards to veterans and mental health. This bill would require the Department of Veterans Affairs to establish a program to fund an academic study for mental health among women in that serve in California. When it comes to mental health in the veteran community, I think that sometimes women are overlooked. So as a veteran, the Assemblyman's a 21-year combat Marine veteran. It's very important for him. He's also serving on military and vets as vice chair. Okay, AC 11, authored by Assemblyman Ahrens, Anesthesiologist Week. AC 41, Assemblyman Patterson, California Down Syndrome Awareness Week and Day. ACR 33, Assemblyman Zabur, Rare Disease Day. ACR 43, Assemblywoman Pacheco, Bleeding Disorders Awareness Month. There's also bills on Parkinson's Disease Awareness Month, World IBS Day, and we did ask us to co-sponsor with SB 580 for Senator Sheila Vogue. So,
Thank you.
all I got, unless you want me to keep going.
Jocelyn.
Hello, everyone. My name is Jocelyn Ramirez. I am the district representative here at the Coachella Valley office. I don't know if any of you are aware, but we actually have 3 district offices. We have the Coachella Valley office. We have the Imperial Valley office, which 2 of our colleagues are out there, and then our Chula Vista office. So our district is pretty huge. We covered 3 counties, San Bernardino County, Riverside County, and Imperial County. So we do need a helicopter to get from place to place. So I'm happy to be here. We have 2 very important bills that were also heard in the Health Committee, which was AI bills. So we have SB 579. So that would establish a state working group under the Secretary of Government Operations. So with that bill, it's really to help AI and mental health. Obviously, AI is great. It's a great technology. We get fast answers. It could help us in the workforce, but it also creates a lot of mental health issues when it comes to children. So with the Health Committee, we got to hear a testimony of the mom. I don't know if any of you are aware that unfortunately lost her son with suicide because she was talking to a chat box. So that goes to another of our bills, which is SB 243. And these two bills will really just help create some guardrails and just be reminding you, like, this is AI, this is not a real person. And then it would also create a guardrail if anything suspicious comes up, it would be sent to the government, which is government operations. So those are two really important bills that we have, which we hope continue. We have been getting a lot of support from like nonprofits, like healthcare foundations and stuff. We are getting oppositions from ChatGPT, OpenAI. We're getting all those oppositions. So Padilla does not want to switch our language. He's very adamant that he wants to keep it the way it is. So hopefully it continues to go to the assembly and we'll see how those bills go. We do have the Salton Sea Green Empowerment Zone, which we appreciate you writing that letter of support for us. So that will really benefit the Eastern Coachella Valley and the Imperial Valley. So cities like Desert Shores, Coachella, Mecca, Indio, Imperial, Calexico, and Centro. So those will all be lumped in together if they ever like want to get any grants or anything. That would really create that empowerment zone. It will also create workforce development if Lithium Valley ever becomes a real thing. All those job opportunities will be going back to our local communities. So that is also a very important bill. So thank you for your support on that.
And Greg, if you have any questions, feel free to.
Where are you going, San Bernardino? The Needles?
Needles.
We have
Yeah.
leaders.
Sorry.
It's okay. I'll be there tomorrow.
So we are- I'll be
head out soon?
Yeah.
I'll actually be in live today as well, speaking on SB 534.
Oh, okay. Armando, would you like to add anything?
Yeah, I just want to echo what Jocelyn said. My name is Armando Avalos, District Representative with State Senator Steve Padilla. We do have a very vast district, so kind of like what Ashley said, if you guys don't let us know about it, we're not going to know about it. So please just feel free to send us everything you have, and we'll look into it. If we can help, we can help. If we can't, then we work really well with the other partners here in the Coachella Valley. With Wallace's team, with Gonzalez's team, Perez's team, Ruiz's team, we all like to help our Coachella Valley. We're all Coachella Valley natives pretty much. So anything we can do to help, we'll help. One thing that she didn't mention with the SB 534 and the empowerment zone is it also requires the contractors out there working on the Salton Sea to use trained and skilled labor that comes specifically for what they're using. That way they don't just use generic labor and end up causing more damage than what they're trying to do. So that's a plus also. So if you guys have any questions, please feel free.
Regarding, also, sorry, regarding Senator Bowes bill, I actually got to speak with our district director regarding it. And during the Health Committee, Padilla I believe he had stepped out to go to another committee and he didn't comment on it, but when I was speaking to the director, he would have commented on it. Really, because the last hospital from JFK is the Brawley one. So I know if we have that conversation deeper, we would most likely be on board, but that's just a different conversation. Gladly at the two-year bill and it didn't die. So
Can
we'll
we,
continue that conversation.
is there some support that you can provide us from here to connect our lobbyist team
Of
to
course.
connect in Sacramento?
Yes.
I
of
don't know
course.
how successful you've been with connecting with their team in Sacramento, Tish. or-
Yeah, we met with the senator's staff a couple times and walked her through the bill. And we did hear from the staffer the day of the hearing that they were a no recommendation, but we weren't able to connect with the senator directly. So I think I appreciate the feedback and happy to connect. And if there's anything that we can do or any information that we can provide to the senator would be, or to you both would be super helpful and happy to do that.
Question, Fish. You said with her staff, so are you referring to Ochoa?
No, I met with Senator Padilla's staffer, in the Capitol.
Okay.
Yeah, I'm happy to, I'd have to look up the name of the staffer, but I met with her a couple times and emailed a few times about a co-authorship as well. But I know there's a lot of volume, a lot of emails that they were going through, and it was a policy deadline. So I think now that we have a little bit more time to collect information and speak to the senator directly, that I think that would be really helpful.
I think, yeah, I think, and then since they're going, I'll connect you with Jen and.
Thank you. Alrighty, yes.
Oh,
No.
if it's
no,
my turn for legislative
it's yours.
reports, okay. So Nick Calero, District Director for Senator Ochoa Vogue. Sorry, I was late. I am the school bus for my kids, but my mother-in-law canceled on me last minute, and so I'm coming from deep Corona. Our district is very, very big. We Senator was first elected 2020, SD 23, re-elected in 2024, and in between then redistricting happened. And so we are getting to know all the new parts of our district, which includes the Coachella Valley, and we go all the way up just to Needles, and we touch that border, but then we have the high desert as well. We have the pass area, we have Hemet, and gosh, we have all of San Bernardino Mountains. So we are getting to know much of the portion, and just as some of the sentiments that were spoken earlier, please be vocal in reaching out to us. The senator has an open door policy, and she wants to hear from everybody, even if she can't hear from herself. That's what staff is for. And so our field rep, Armando Martinez, is very active in the district. We have one office right now, one in Redlands. We are looking to have an office in the Coachella Valley, either Palm Desert, Rancho Mirage. Budgets are limited, so wherever we could find the best deal, I suppose. And so I wanted to give a quick update on two bills. As we know, SB 558 is a 2-year bill. Senator is very committed to seeing that move forward. And then we have two bills, one that made it out of suspense and one that's still in appropriations. The first bill I wanted to go over is SB 250, and this would require the Department of Healthcare Services to include skilled nursing facilities in their managed care list. Currently, right now, they have doctors, dentists, hospitals, but not skilled nursing facilities. And so we're supposed to see a significant increase in the next 20, 30 years of individuals who are going to be needing the services of skilled nursing facilities, and sometimes need to choose one quickly. And so HCD Healthcare Services already collects that data, and so it's just transitioning that data that they already have and putting it onto a public-facing database so folks can make informed decisions. I believe that one is still in suspense. The next bill I wanted to talk about is SB 389. This would remedy an unintended consequence from a Senator Roth bill in 2022. That was 1436, which would require LVNs who are going to perform certain respiratory treatments to be done so under the direction of a doctor or something of that nature. Would the unintended consequence was it also required LVNs who are working in school districts that were governed by the education code were also lumped in to that requirement. And so you can understand the logistics and the difficulties of having a procedure done by LVNs in a school district. And so there's a additional bill that extended the deadline to 2028. This bill would fully clarify that and create guidelines for proper operations for the LVNs working in the school districts. And so that bill itself, I believe, made it onto the Senate floor. And so we expect to have a vote on that. I wanted to go over a couple budget requests that the senator has co-authored or signed on to. The first one would be funding for the long-term care ombudsman program. So we're asking for an additional 15.9 million, which would bring the total funding up to 33 million. the beds, ratio per ombudsman is pretty high. And so we're looking to reestablish, some funding. And we saw, staffing drop significantly over the years and especially after COVID. And so we're looking to increase some of that staffing and the benefits to that would be really significant, especially since we're going to see an increase for those needs again over the next like 20, 30 years. The next bill or the next funding request I want to talk about is a budget request that the senator is sponsoring with Senator Gomez Reyes, and that is a 20 million one-time general fund appropriation. And that's going to support and stabilize California's 211 program, which alleviates a lot of 911 calls to be focused more on actual 911 emergencies. And it's a wonderful care access network, especially during COVID. Our office personally saw this when each staff member was handling like 120 plus cases. But one of our go-tos was 211, but they were just sorely understaffed and couldn't handle the need for services. And so we'll keep you posted on that. And then the last one is, there's two more. So she's also doing a funding request for $75,000 of general fund allocation that would create a working group that would do the food systems. It would create a working group of food system experts, healthcare professionals that would be to supportive food, a medically supportive food and nutrition program, and see how the pilot program, which already exists, and how that could be absorbed as a permanent Medi-Cal service. And the last one I want to go over is a budget request of 2.2 million, bringing the total funding for 5 million for the California Alzheimer's disease centers. There's 10 currently in the state. And so again, with this, it's estimated that by 2050, we're going to see an increase of 21% of folks who are going to need those services. And so this would stabilize and increase the availability of those services and early detection and coping with Alzheimer's. And that's it. If there's any questions, I'd be happy to answer.
Chris, we will go after the meeting or during, we can go over some of these bills and budget requests that we should be supporting. I know for sure the 211 program is something that we dealt with here.
Yeah, I'd be happy to send you our letter as well.
Yeah, be great.
Okay.
Thank you, Frank.
Hi, everyone. Good to see you. Good to see you all. Some of you may know me, Frank Reese. I'm the district director for Congressman Dr. Raul Reese. And as a physician, he is deeply concerned about the inequalities in the healthcare. And with potential Medicaid cuts, this is going to get ugly, right? So we've been meeting with a lot of Medicaid providers in pretty much the counties, that we oversee, Riverside, parts of San Bernardino, and Perry County. And understanding the impacts to the hospital, the impacts to the education system, because it has a lot of overlaps. So we need to understand that comprehensively. And we've been meeting with IEHP, we've been meeting with all the health providers. And this is a good opportunity, even though I may not know the specifics about all the bills, that are introduced at the state level. But I would love for you to reach out and let us create this alignment. Obviously, we at the end, we serve the same constituents, right? So we need to understand, how can we support each other? And as a physician, he is deeply concerned. And with everything else, that is kind of like looming right now, I think it's useful for us to continue these conversations, understanding what's California gonna do once the federal government reduces a lot of this funding. And we met with when we met with IEHP, they were saying that potentially if Medicaid's cut to that level, it may force some of the local hospitals to even close some of their services. We have 3 hospitals that they specifically identified with San Gorgonio, Needles, and Colorado River. no, Needles and the one in Black,
Palo Verde.
in Palo Verde. And so, I think it is important, to have these conversations, so that we can understand, what is the synergy and what is the alignment that we can, help each other. Thank you for the invite, and I'm gonna, allow my colleague, Daisy to provide specific, information on some of the, legislation that Congressman Reese is working on right now.
So this 119th Congress was in session every 2 years. He joined the reintroduction of the bipartisan health out-of-pocket expense, the HOPE Act for 119th Congress. Basically, the HOPE Act will create a tax advantage account that enables millions of Americans with most types of insurance coverages to save healthcare costs through both individual and employer contribution. In March, he also really shepherded the first Democratic Physician Caucus to take place in DC. The caucus is dedicated to promoting health and well-being of Americans, advancing pragmatic healthcare policy, and providing fellow members with insights on critical issues. So it's him and 5 other physicians as part of the caucus. He was super excited to launch the caucus to fight for quality, affordable healthcare for American families. And obviously, as doctors, they understand the pain and suffering that people endure for not having access to care. They will work to ensure that every American has the health care that they need. In March, at the end, they also, went to condemn mass layoffs at AHC, FDA, and CDC. They were calling for an immediate reversal of these dangerous layoffs and other things, because we understand that you need a lot of researchers, you need a lot of people to make sure that we stay as healthy as possible. And just today, he's part of the House Committee of Energy and Commerce. They're being forced to vote on legislation that plans to slash billions for Medicaid funding. So he will be working overnight, literally trying to vote to, do as much as he can to save Medicaid. He's pretty passionate about that. And, latest research shows that millions will lose coverage and thousands could die each year if these cuts go through. As a member of the committee, he's going to speak out as much as he can regarding these proposed cuts and highlight the devastating impacts that they would have on communities in California's 25th district. And so, Chris, I think you attended the roundtable that we went to, because what he's trying to do is ensure he captures the stories of the impact that Medicaid cuts will have, to really highlight and put images there to really for people to understand that this would be devastating, especially for our district, because our district is so large and has these rural areas that really need as much help as they need, not the opposite. So,
And just to provide, some data, the Riverside County, 47% of the people depend on Medi-Cal. In Imperial County, 87% of the people. So these cuts are going to be, devastating if they go through.
Thank you for the update. Any public comments from
There's no public comments, but Amy Cooey, Cohen McDuffie with Supervisor Perez's office, who's the government relations and public policy advisor, she couldn't make it, but she just wanted to reiterate the fact that the county recently passed a resolution to support Medicaid funding. Over 1 million people in Riverside County are relying on Medi-Cal, obviously in the state of California. So they've passed a resolution, which also urges the federal government to continue with the funding of Medicaid.
I'd just add on too, for all offices, is that we'll be publicly releasing our annual point in time homeless count numbers next week. Actually, we'll put out on Thursday with the board agenda. But we've utilized not only registration into Medi-Cal, but also the community supports aspect under CalAIM for cost savings when it comes to housing and homelessness. So with these type of cuts at the federal level, those are probably some of the first things that will be on the chopping board, is some of the waivers for programs like that. So it's an essential, it's just essential that we keep because it would be truly devastating. I mean, Frank's right, is that over half really of Riverside County residents, and I would venture to say San Bernardino is probably pretty close as well. That's their only form of healthcare. And so to me, it shouldn't be a bipartisan, or should be a bipartisan issue. Because in all reality, throughout the country, is more people in red districts are on Medi-Cal than they are in blue. So that's my politics a little bit.
So, any questions or comments from staff members?
Does the congressman have a feel for what might be happening in this committee?
He does, but we're being told that, we're keeping something to be a surprise.
Yeah.
So I wish that we could, I know. So you just. And,
Okay, all we can say is, let's hope for the best and plan for the worst.
just want to see him in the committee. It's public, so, feel free if you can stay up, 24 hours. Our staff are working as much as they can to be helpful, but it's a wild ride.
And we appreciate being part of that roundtable.
Yeah.
Yes, of
Any
course,
of the
of course.
discussions.
And we'll look to continue those roundtables, because I think this is not something that is not gonna stop anytime soon. This is something that we foresee continuing.
You know,
The near
I
future.
actually learned something new. I think Alejandro has the online kind of like collaborative meetings. They were so helpful, just, I've been doing this for some time and I think I'm very familiar with resources. And then he gave his, presentation and there was other resources and I was like, oh, I didn't know this. So we're constantly learning to stay as up to date we can to help constituents, right? If they need resources, figure out where to send them. So thank you, guys.
Thank you.
Well, once
We could
again,
send-
thank you. Oh, yeah, go ahead.
I said we can send the invitation out to the other,
Yeah.
Oh, no, I know. Kidding.
I was gonna say, thank you once again, for joining us and providing an update. Like mentioned, right, for me, it's one of those things where like, I just can't expect other people, right, to come out and look and want to learn from the district, right? I mean, you might not think so, but it's a very exciting district. And there's so much to learn about and we're doing such a great things, in the community. And so I wanted to make sure that we had a platform where we can be having these conversations. I don't think that, and this is something that I would like to hear from the room as well. I don't want to add just another like legislative meeting to your guys' calendar. I know how hectic it can get. So I'm thinking maybe we could like meet quarterly or a few times a year just for like updates. But please know that this legislative committee and the full board of the district, we're here. If you guys need anything, I'm familiar with the California legislative process, so I kind of know already, like, let's start reaching out to folks. But please use this committee, use this platform, the district. If there's something that you need our support with, do not hesitate to ask. We're here. We know we're a public entity. We're all of our constituents, the people that we serve, and I think that's what we have in common, which is different levels of government. So we're happy to be providing you an update as well with what we're doing, especially within like this committee. Will make sure that we communicate with you all, but please do not hesitate to reach out, either me directly, our CEO. In the future, we will be hopefully hiring legislative relations liaison to the district, which would be your to-go-to in the future. But as of now, please do not hesitate to reach out to Chris, CC, Andrea. That's a little tip, she'll get back to you for sure. No, nothing. It's the same as, the senator is similar, they're busy.
Yeah, you have one more.
Their support staff will be able to help. Do you guys have any questions for us? No? Go ahead, Chris.
Just wanted to remind, this is a monthly meeting on the second Tuesday of the month. You're always welcome, but as our chair said, we understand, you're busy. And so quarterly's, better for you. We understand that, but you're always welcome. We want to hear and understand what you're doing, and then how we can be a part of. We'll definitely communicate with you along the way as you've all suggested, and likewise, anything that we can do to support your efforts along the way, we certainly will. So,
And they do have the capacity to call you.
Yes.
oh, yeah,
Yeah.
exactly. So you
Make it
can
personal.
remote, as well. Absolutely.
If you don't
So-
have anything to do, it's like a Tuesday of the month and it's 10:30 in the
Yeah,
morning. and you don't
10:30.
tune in. Yes.
If I just want to mention maybe, we're also looking for a strategic plan facilitator to help us for next 5-year plan and also going forward with the influx of $100 million that we'll be getting in 2027 when the lease begins, the 30-year lease with the purchase at the end. So we're gonna be looking to, look at how we can go forward, filling gaps and challenges and having all of your guys' input too. probably.
Yeah, so we're gonna hold, I'm sorry, to continue with that. We'll be holding several public meetings with the board, and also we're planning to do at least 2 community sessions to get community input, so we certainly welcome any participation from your offices. Like Donna was indicating, it's
All of you guys' emails, so.
yeah, and we'll keep you published on any of that, but it's intended to be a long-term strategic planning process to create, a vision for, 20, 30 years out, but then also to develop a new 5-year strategic plan, beginning 2026 after our current plan expires.
And so the reason why this is so important is because we base our funding on our strategic plan. And so, well, we support or how we support the community is based on our strategic plan. Well, a very good portion of it is, so that's why it's very important. So we'll be asking for community input and hoping that you guys can walk with us as we create this plan. Like Chris mentioned, it will be a 5-year plan, but then it will have other long-term goals on 20, 30 years as well. Right. Thank you. Does anybody have any questions? Any last comments? All right. So thank you. We'll go ahead and adjourn the meeting at 11:41. Thank you. And then that's pretty.